I'm so honored to be here. When I heard that the topic was monumental and they reached out and asked if I would come and talk about community hospital and they connected monumental with community hospital, I was pretty flattered. There's not many more things I enjoy more than talking about community hospital, so I absolutely agreed to come and talk and share. What I'd like to do today is quickly just go through some of our growth, some of the things we've been doing at community hospital, but I really want to spend the most of the time talking about how we got here, what we're working on, what our mission is, what our philosophy is, and our strategies around making sure we're a community asset. And so with that, I'll go through a few slides quickly, but I really want to spend most of the time talking about what it is to hopefully have a great organization. So community hospital, as you mentioned, was started actually by three physicians, Maynard, Krebs, and Maynard, three osteopathic physicians that were not given privileges at St. Mary's, so they started their own hospital. And so it was a small little hospital. It's evolved over the years. We were at 12th Street. When I started at 12th Street, and interesting, in 18 years, I've now been at the new hospital longer than I was at the old hospital. But we were at 12th Street, again, mainly osteopathic medicine, started to get a few MDs coming over. About 9 years ago, we built the new community hospital out on G Road. And I remember when we were talking about that, they were saying, don't build way out there. No one will drive way out there. And so since the day we opened, the parking lot's been full. Our most recent addition is the James Pulsiver Cancer Center in our medical office building. At the original hospital, we had about 80,000 square feet of campus. Today, we're at about 370,000 square feet. We still have about a third of the new building for whatever is next as we go forward, but excited about that progress. One of the things that I think has been part of our biggest success is we've just had so many great physicians, nurse practitioners, and PAs join community hospital. I came from Kansas. I'll tell a few stories about Kansas. When you're recruiting a physician to Great Bend, Kansas, and your opening pitch is you're only 2 hours from Wichita, it's a tough sell. So I can tell you this has been a dream to recruit to Western Colorado. We just make sure they have 2 bikes, 2 kayaks, a 3-car garage that they can only get 1 car in. And so then we're set. But we've had just great physicians, both coming from other parts of the country to join us, but also local physicians joining us throughout our last 18 years. This is really small. We did put it out in the hallway, but this is just a real linear demonstration of all the new services, the programs, the awards that Community Hospital has had over the last few years. It has been so fun to be the administrator at Community Hospital and getting to do these new projects. And when something comes up, we kind of jump on it and go forward. But we've been busy. Okay, one of our goals, and I'll talk a little bit more about being an independent hospital, but our focus is this valley. And so we have really tried to make sure there's access to care. We want care to be delivered where it's convenient to you. And so that's why you see we have clinics in Palisade, Fruita, kind of everywhere in between. Don't come to the hospital. I'm going to charge you $1,000, cover charge to come to the emergency room. Go see your primary care doc. So we've tried to be throughout the community. Our newest clinic out in Palisade, what a fun partnership with the city of Palisade. And one of the stories I tell there is Greg Nicolai and I were driving around looking for a location, and he suggested the old high school. And I'm like, oh, that looks like a money pit. I can't imagine what that's going to cost to rebuild. Came back later and said, well, what if we tear the old high school down and you can build it on that site? And I was like, well, okay, now we're talking. And so we started having some community meetings, and boy, the town of Palisade was upset. You can't tear our high school down. You cannot tear our high school down. And so we said, but we're thinking about putting a medical clinic here. And they're like, okay. I mean, it stopped so fast as soon as we did that. So anyway, when I was interviewing for this job, 18 plus years ago, I was also interviewing the community, and I would talk to the receptionist at the hotel or the waitress at the restaurant. I'm like, okay, tell me about healthcare. Tell me about the hospitals in Grand Junction. And what I got a number of times was, well, if you're sick, you better go to St. Mary's. But if you want it fast, go to community hospital. And so I'm like, okay, got my hands full. Well, I can say 18 years later, now if you're sick, come to community hospital. Okay, we've been Best of the West for 9 years. We're one of only 6 surgery centers in the state to be recognized by U.S. News World Report, 5-star from CMS in 24, centers of excellence in orthopedics and our bariatric program. So I think we've made tremendous steps forward on the level of care and the amount of services we provided. And oh, by the way, we're still pretty quick. 16 minutes to be seen by a provider in our ED, less than 2 hours to get in and get out, well above the national and state standards. So we're pretty proud of the ED. Okay, when we talk about growth, here since 2016, net revenue is what we actually collect. Medicare doesn't pay us what we charge. We get a rate from Medicare, we get a rate from Medicaid. But here's the growth over the last, 8 years? So we've grown 235% over that period of time. This year, we're anticipating we'll be about $300 million in net revenue at Community Hospital. And so excited about the growth. One other asterisk I'd put in here is hospitals all get designated a little bit differently depending on where you're located, and you get different reimbursements from Medicare. Medicare makes up 50 to 60% of our revenue. Medicaid, probably another 20. Community Hospital is the only hospital in Western Colorado and Eastern Utah that doesn't have a special designation. St. Mary's is considered a sole community provider. Technically, they're not supposed to be within 35 miles of another hospital to get that designation. Anybody walk that or driven? You'd have to really work hard to make 35 miles between us and St. Mary's. They get anywhere from 12 to 28% more from Medicare than we do. And so we're working on that, but that's put us at a big disadvantage, but we've prospered since. Okay, here's the clinic in Palisade. Here's the new daycare, really a proud project here. Mesa County is still a daycare desert. We're still about 4,000 daycare slots short. So we're excited to work. Senator Hickenlooper, Senator Bennett helped us with some funding for this. And so this is 106 slot daycare. About half are community hospital employees and half are from community hospital. I remember big C or little c here. The other half are from the community. And we do have plans, and we're working we can do 2 more of these at that location so we can get up over 300 slots. But it was full, I think, 6 months before it was open. And now we have I understand this, we have a 2.5 year waiting list. They'll be in kindergarten by then, so I don't know if it means much, but anyway, okay, so that's kind of our growth. I think when I started, we had 386 employees. Today, we're over 1,400 employees. The services, it's much easier to say what we don't do now than what we do, and so still not doing open hearts, NICU, neurosurgery, but it's really, we've closed the gap, and that's been one of my goals, is I think competition is really important. I think having choices, I want you to deliver your babies at Community Hospital. So we're going to do everything possible to make sure they have a great service. And I'm sure St. Mary's has stepped up their game because we're in it. And so it's appropriate for a lot of things, not everything. Healthcare is expensive. There's not enough open heart surgeries being done in Grand Junction to have 2 programs. We'd really have 2 mediocre programs, so we support St. Mary's heart program. All right. So one of the things I mentioned earlier was the independent hospital. Throughout my career, I have worked more than 18 years. I think I'm in year 36 now total in healthcare. Started long-term care, but had a chance to work for systems 3 times. My last job in Kansas was a system job, and being here in Grand Junction with an independent hospital was a purpose. It was a reason that we chose to come to Grand Junction. We have the autonomy to do what's best for our community. Our board of directors is your neighbors. Your friends are on our board of directors, and we have one mission. We have the mission to take care of our community. Systems care also about their communities, but they're also torn. They also take care of their system, and the system I came from had 81 hospitals across the country, and so I was one of 81 hospitals that was fighting for capital, fighting for resources, and many times their priorities, while they may be good for the system as a whole, may not be good for the local hospital. So one example I have is when I was in Kansas, I was very careful. We had 3 local banks, so I would keep money in each one of those banks. If I had a golf tournament, they were there. If I had fundraisers or they were on my board, they were there. They really supported us, but I tried very hard to make sure that we supported the community that was supporting us. The system decided that across 81 hospitals, they were spending too much money on banking fees because I had 3 banks. Probably every hospital had 2 or 3 banks. So they decided to centralize all their banking in New York City. The system saved $20 million on banking fees. Guess what happened to my support from the local banks? Gone. I couldn't blame them, but I had to take all that out. We centralized our business office, our accounting office, our HR department. We put the business office in Boise. We put the accounting and HR in Denver. I laid off 50 people in Grand Junction, in Great Bend, Kansas, town of 15,000 people, let's just say average salary of $50,000. My community lost $2.5 million of salaries by centralizing those businesses. Systems don't make money, the local hospitals do. So you pay what's called corporate allocation, corporate overhead. My overhead the next year went up $3 million to support the system. Lost $2.5 million of wages in my community, but my costs went up. And so I was done. If you want me to run the hospital, let me do what's best for the community. So this has been a dream for me. We have our board of directors. When we have an idea, we come together, they give me the latitude, and we go. Our favorite story, excuse me, I'm jumping ahead now. Anyway, I just think there's a lot of value to the independent hospital, and that's part of the reason that I've stayed at community hospital. Now, getting into some of the details on kind of where I think our successes come from, I think there's really 4 things I want to talk about today. One is leadership. Second is keeping it simple, that old KISS method. And finally, being a great partner, and then being agile. When I was interviewing in Great Bend, Kansas, you interview with the directors, you interview with community members, you end up interviewing with the board of directors. And so I'm sitting in the board of directors, they're all around a table, I'm at the head of the table, and I think there was 12 of them. And remember, this is a Catholic hospital. The convent was across the street, and the Mother Superior was on the board of directors. And so I think I was 39 at the time, and I was cocky, and I was really good. I'd run a little hospital, and I'd been a vice president at a big hospital, and the board was asking me questions, and I was rolling through them and doing really well. And it came to Sister Gemma, and she looked at me very calmly and quietly and said, "Chris, describe your management style as it relates to the life and teaching of Jesus Christ." Yeah. And I was like, I should have been prepared. I mean, I'm interviewing at a Catholic hospital. This should have been, but I stumbled, and I can just remember thinking, "Chris, you're not going to BS your way through this one. She knows way more than you do. She knows way more than you do." I'm not sure exactly what I stumbled through for some answer. It must have been okay. They hired me. But now that I reflect, it was really a really easy question. It was be a servant leader. Take care of your people. And so, that was a moment for me. And so how I've tried to be a leader at community hospital, how I've tried to help our people be servant leaders, guys, and luckily, I don't take care of any patients. I don't do anything clinical. I've got to have great nurses. We've got to have great techs. We have great housekeepers if we're going to get things done at community hospital. So our role as leaders at community hospital is really simple. We have to make sure that we find the best people. We give them all the tools they need to do their job, to take care of our patients, and then we need to stay the hell out of the way. The worst we can do is meddle with them and get in front of them and not let them do their jobs. And so I think that's been a cornerstone of really trying to develop community hospital over the years. I also think healthcare is, it's a serious business. I mean, we have life and death situations. Luckily, when we moved in the new hospital, we started delivering babies again. And so that's been a real joy. And so this year, I think we're going to almost deliver 700 babies at community hospital. We play a chime every time a baby's born. And so it's a very exciting. But we have the other side of the spectrum, too. We have cancer patients and patients who are not going to make it. And so I've tried to create a balance of, okay, it's serious work, but you know what? We need to have fun at work. And burnout is a real issue, I think. We mentioned the turnover rates and some of those things. Hospital turnover rate since the pandemic is 38%. Annual. 38% of people are leaving the career or changing jobs or just moving somewhere else. We're fortunate at community hospital, we're at 18%. That's still, on 1,400 people, that's still a lot of people we're hiring every year. And so we're trying to make it a great place to work. And so we try to, hopefully if you ever walk around community hospital, you feel the difference. We want people to say hello. We want people to put their cell phones away. We want them to take, if you've been in big hospitals, and when that person's lost, you see they're lost. So we really push, just take them. We're not that big of a hospital. Take them where they need to go. Do the little things, and you know what? And then have fun with your coworkers. And so we joke a lot, and some days we're like, I don't know how the hell we're open. Our marketing director, and she's wonderful. You probably see a community hospital billboard or two, or maybe a social media post. And so the team pokes her pretty hard. They say her motto is prompt service takes time. Okay, and they give her grief on that. Our chief nursing officer, chief operating officer, he's probably one of the finest detail-oriented planners, organizers. When we started our cardiac cath program, we started the robot program, the day we took care of the first patient, it went flawless. He is an eye for detail. The housekeepers knew what they were doing. Everybody knew what they were doing, but don't ask him for math. okay? And so we poke him endlessly. And then I had I guess it was the privilege of turning 60 this month. So they brought me a walker. I want to make sure I don't fall and hurt myself. And so anyway, I do think that's contagious, though. I mean, we're trying to have fun, and so everybody knows it's serious. We got to move forward, but we want to take care of our patients. So being a good place to work. All right, keep it simple. I go to orientation. We hire people. We have orientation every 2 weeks, and I think it's been really important. I ask them to do two things. One, take care of each other. Hospitals, we have good days, we have bad days. The ER can get blown up. And I'm like, you got to be here, though. You got to be here because there's nothing worse in healthcare than having someone call off and not show up for work. Because if you have 10 patients and you're supposed to have 3 or 4 nurses and only 2 show up, their day is miserable. And so it's like, just be here, take care of each other. And the second thing is we talk about is take care of our patients. Take care of them like they're your mom, your grandma. It's really interesting. I was in an elevator. This was back in Kansas again. I was with a new nurse. I hadn't been on the job for more than 3 or 4 weeks. And I said, how's your day going? And she said, well, so far so good. We don't have any patients. So I'm like, oh boy. Because guess what? If we don't have any patients, guess what else I don't need? Nurses. So I try to say, God, it's in our best interest if you take really good care of our patients so they keep coming back. So we work on that a lot, keeping it simple. We have tried really hard at Community Hospital to be great partners. If you see me, we're out there. If the media needs us, we're doing interviews. If organizations, we got a call yesterday, I think, from the health department. We have an agency that's really struggling, and so we're going to find some cash to help them get through the situation. CMU during COVID. COVID was a really interesting, challenging time for all of us. We sent our infectious disease physician, our chief medical officer, ED docs to CMU to make sure they could keep their doors open and keep their students in person learning. Phil Onifero, the CFO of the school district, called me in a panic. I was up on a mountain by Telluride, and they were going to try to open the schools here at District 51, but they couldn't find any sanitizing hand wipes for the classrooms. And so we got on the phone, got our connections, and Phil had cases of hand wipes, in time for them to start. But we've really tried to pride ourselves on saying yes and being a good partner. We want you to choose Community Hospital. I have to be there for you. And so if you see us, we're out there and about. And I think other than, those basic things of really taking care of your people, hopefully having a great workplace, I think at the end of the day too, guys, it's just do the right thing. So every morning, if you do the right thing, your gut tells you when it's the right thing. I tell you what, you'll sleep better. But anyway, thank you so much for having me. It's been fun to talk about Community Hospital. So.